Right now at 4:46 in the afternoon, we turn our attention to 5 on your health, and there is a new variant of the flu virus that's creating an early surge of very sick patients in the UK, Canada, and Japan. And some experts say it's now on track to cause even more trouble here in the United States. Of course, Canada is our immediate neighbor to the north. Joining us right now, as you can see, is Dr. Todd Ellerin, South Shore Health. You've been through a lot of flu seasons in your career. Are you worried about this one?
You know, Eddie, I am worried. And, you know, they're calling this the K variant. It's an H3N2 subtype. H3N2 subtypes tend to be more severe in general. And the bottom line with this is what's happened is that the virus has mutated so quickly that the virus type that was chosen for our vaccine that we currently have, it's already changed from that. So the concern is that it won't be as effective as, you know, we thought it might be.
Is there potential? Are you worried? Is there concern? I hate to use the word again, but could it reach a pandemic level?
It's a good question. I don't think pandemics typically happen when there's a major shift.
Yeah.
This I would call a very major drift.
Got it.
But I think this H3N2 has been around for a long time, so I think there's population immunity, even though we may not be quite ready for these mutations.
So we do know that doctors obviously can test for the flu. Could the results also tell you whether someone has this new variant?
The answer is no. When we test in our labs, we can tell whether you have type A or type B, right? But we can't get down to those subtypes. But what we do is, first of all, the CDC, nationally, they can do advanced type testing. And then, for instance, our lab, the Department of Public Health asks us to send them a certain number of isolates so they can do testing. Not just our lab, but other labs, you know, across the state. So in that way, we can sort of tell whether we have that specific subtype here.
So I did, full disclosure, I got my flu shot about a month or so ago. So am I protected, or am I exposed, or am I, you know, not protected?
Right, and I don't think we've done the best job at this over the years, but remember, the flu shot is best at protecting against severe illness. So yes, it will protect you, it will reduce your likelihood of hospitalization, even if it's not well matched and doesn't necessarily protect you against the flu. Let's face it, many of us get the flu shot, we still get the flu, but most of us don't get hospitalized, and that helps it. I will tell you, in the UK, and remember, Europe can be a harbinger of what's to come here. They have seen that there's still about a 70 to 75% reduction in hospitalization in kids that got the shot, and a 30 to 40% reduction in adults. So that may be less than other years, but it's still the best defense we have.
Dr. Ellerin, thanks.
Good to see you.
Great info as always.